All right. Good afternoon, everyone, and thank you to folks in the media for joining us. My name is Chip Partner. I'm Assistant VP for Communications at the University of Rochester Medical Center. My colleague, Veronica Chiesi-Brown at Rochester Regional, and I have both been getting some questions recently about how, as the COVID case numbers being reported by the county decline and the positivity rates at the state level and regionally decline, how are the hospital systems impacted? So we thought we'd ask Dr. Mike Apostolakis and Dr. Rob Mayo, the CMOs of our respective systems, to make themselves available. So thank you both doctors for doing that. We don't have an opening statement on the URMC side. I don't know, Dr. Mayo, if you wanted to start with anything or just open it up for questions.
We can just move right to questions.
Okay, I'll kind of in the order folks appeared on my screen. We'll start with Kayla Green at Channel 8, and then Andrew Banis at 13 Wham, please.
All right, good afternoon. Thank you guys for doing this. So I guess my first question would be just, how many people are you seeing hospitalized lately, and are the people being hospitalized largely unvaccinated?
Yes, that's a great question. We are still seeing anywhere from 2 to 5 patients admitted a day with COVID, and the vast majority are unvaccinated persons. This has led to us continuing to have about 70 patients in the hospital that were admitted with COVID. At our peak, we had about 300 patients, 400 as a system, and right now as a system we have about 100 COVID patients and 70 at Strong, and that still represents about almost 10% of our inpatient beds. So with non-COVID illness patients returning with these extra 10%, it's kept the hospital quite full and quite stressed.
The picture of COVID is very similar in the Rochester Regional Health Hospitals as well. So presently our system census is about 55 inpatients with COVID. There are still a number of them in the ICU on ventilators, quite ill. It's important that no one forget that COVID is still a very serious illness. And we're grateful that the total numbers are down compared to the peak in Rochester Regional Hospitals. We're down almost to 15%, 10 to 15% of what the peak was. But those who are there are still very sick, and it really is unvaccinated folks. We are aware of some breakthrough infections of people who were vaccinated and later tested positive, but those patients are almost invariably asymptomatic or very, very mild symptoms. And the positivity is discovered on routine testing.
And this is why it's vital for everyone who's 12 and over to get vaccinated. As was just mentioned, patients who are admitted to the hospital are still sick, still going to the ICU, and unfortunately, some will still die. The vaccine is almost 100% effective in preventing severe illness, hospitalization, and death. So we encourage everyone age 12 and older who hasn't been vaccinated, get vaccinated as soon as possible.
I did have a follow-up. I don't know, are we doing follow-ups right now?
We'll do one follow-up for everybody.
Okay, great. Okay, so yeah, my follow-up, just wanted to see if I could get your reaction on the Hawkeye site closing. Got confirmation from the state about that today. Just curious if you're still confident there will be enough access to vaccines with only 50% of the population 12 and older being vaccinated. Does it concern you that that site is closed?
I can tell you that the Finger Lakes Vaccine Hub is looking at this very closely, and together as a region, we're going to assure that areas that are under-vaccinated have pop-up sites that we can vaccinate the community. So I'm confident that through our Finger Lakes Hub, we will make vaccine available to those areas that need it. And so the vaccine will be there.
And continuing to encourage folks to step forward and get their vaccine remains vitally important to all of us. So the demand, as you know, it in part drives access, and access, it's like a chicken and the egg, access also in part supports demand. And so we want the community to keep coming forward, and we as a partnered set of institutions with the health department across the region will continue to do our utmost to deliver those vaccines.
Thanks, Dr. Mayo. Thank you, Kayla. Andrew Banas from 13 WHAM, and next on my list I have Patty Singer, a Minority Reporter. Andrew, take it away.
Hey guys, good afternoon.
Good afternoon.
I wanted to ask about first the vaccine percentage for staff at both hospital systems. How far along is that? Are you still finding some people hesitant within the staffing, and what's continuing to be done to address that?
Sure. So vaccination hesitancy, I think, will, persist. Human nature is what it is in that regard. And so, yes, we are continuing to educate. We're continuing to encourage our team members and employees to be vaccinated. We have, as any large organization has, a steady stream of turnover. And so as new employees come into our health system, we provide them education, facilitate their appointments in employee health for vaccination. And so we are really striving to drive that. So we're pleased with the progress that we've made. So we are also, finalizing the last steps on an additional thrust for a vaccine campaign to keep this at the forefront of folks' minds. We don't want the fun of summer to minimize the importance of this vaccine and its ongoing value.
Yeah, excuse me. At URMC, we're approximately about 80% of our employees have been vaccinated. There are a number that are continuing to think about it. And so we offer vaccine to our employees on a regular basis. They can sign up through their managers or through their supervisors. There is some hesitancy, and there's a certain percentage, like in the population, that do not want to get vaccinated or medically can't. But we are continuing to encourage, educate, and make it available as we have new employees coming each week as well in this large system.
Mm-hmm. Yeah, Rochester Regional is over 70% vaccinated, and we keep urging people to reconsider if they have not been vaccinated thus far.
I have a follow-up for that exact question, and then I have a completely separate thing. I can wait till the end to ask about it, or I can just do it all now. Chip or Veronica, whatever's easier.
I think I'd ask you to wait for the end and just do your follow-up on topic, please.
Sure. So the direct follow-up is, do you see it as this, as Pfizer and Moderna prepare to become fully authorized, not just emergency use, that that's something that might eventually become a requirement for employees at both hospital systems?
Well, we are aware that that's being considered around the country in various institutions, and our commitment is that we will be working with the Department of Health and with URMC, and this would be a decision that we would want to make as a community. And so at this point, there's been no plans to make this mandatory that I'm aware of.
Yeah, there's been discussions with the state at our medical center. And as Dr. Mayo says, if a decision's made in this regard, it will be either a state mandate or a regional or a city agreement. I don't think that that one health system or the other is going to mandate without the other. And I think it's important for our community. Both RRHS and University of Rochester Medical Center have worked together from the beginning on this pandemic for our patients, for our community. And if any decision like that is made, it would be both of us in agreement. But as Dr. Mayo said, there's been no decision made in this regard yet.
Thanks, Andrew. We'll circle back. Patty Singer, you're next. And after Patty, Raquel Stephen at WXXI.
Hi, thank you. I think it was Dr. Pastelakis said that 10% of inpatient beds were with COVID people. To someone not in the healthcare system, 10% doesn't sound like a lot. I think you also mentioned, or Dr. Mayo mentioned, the hospitals are full and stressed. Can you please provide some context on that, what full and stressed looks like with 10% of ICU beds with COVID?
So I said 10% of inpatients have COVID. And you have to remember that pre-pandemic, the University of Rochester Medical Center was 100 or 105% full pre-pandemic with non-COVID illness. We are now back doing and seeing as many patients from the community with non-COVID illness as we were before. And on top of that, we're caring for another 60 or 70 patients. So it may not sound like a lot, but 100% plus another 10% makes us very full and very stressed. And we've had a staff that's now been working almost continuously at a high level for 18 months. It's a lot of stress from working, from worrying about family members, from worrying about loved ones, from worrying about their jobs. So there's been a lot of stress, a lot of hard work. Hopefully we see the light at the end of the tunnel, and what could help our institutions and our staff more than anything is if our community were to get vaccinated fully. That we'd like to see at least 70 or 80% of the population that's eligible get vaccinated. We think this will help prevent spread of the disease and put an end to this pandemic.
Okay, thanks for the context on that. The county on its dashboard has not been putting in for a while hospitalization numbers, ICU numbers. I'm wondering if both you gentlemen can give us some sense of the numbers in the ICU and the ages of people in the ICU.
Patty, thanks for the question. I'm not prepared today or in this moment with knowing the ages and the average demographics of ICU patients. So that's something that we can look at another time. But certainly the ICUs during the height of the pandemic were very stretched, and we had expanded ICU capacity into non-traditional ICU rooms. That is no longer the case, thankfully. We're able to manage the needs of ICU patients in the ICU rooms as they are currently configured. But they are full, and day to day we are managing the needs of those patients and the staffing that's required to care for them.
Dr. Pastelakis, is there anything on that?
Yeah, Patty, it's a great question. I can tell you that the average age of our patients being admitted to the hospital is younger. It sort of correlates with the percentage of vaccinated. People over 70 in our area, the vast majority have been vaccinated, and we're seeing relatively few admissions. We're seeing more admissions in the 40 to 60-year-old range. I can't tell you specifically in the ICU what the age is, but I can tell you for all our admissions, the average age has reduced significantly, and it's directly related to vaccination.
Thank you.
Thanks, Patty. Raquel, you're up next, and after Raquel is Brian Sharp at the DNC.
Yes, thank you so much. My question is in regards to these breakthrough infections. Can we say that these infections are being caused by variants, or what variants are we looking at, or do they correlate at all to these variants that we're seeing, these breakthrough infections?
The breakthrough infections that we've seen have been mild and not reasons for admission to the hospital, save in very rare cases. So the breakthrough infections we're seeing are people who may be admitted for another reason and then have an asymptomatic infection that we catch because we're checking for it. We have had a very small number of infections in people that have severe immune deficiencies that have been vaccinated that did have what appear to be severe COVID infection, but that's very rare. The vast majority of people who are vaccinated are protected from hospitalization or severe illness.
Yeah, I fully concur with that, Raquel. I think that the concern about variants will remain, and we will certainly, with the Department of Health, be testing for that as specimens are sent out on a sampling basis. And thus far, the vaccines are effective against the variants. And so that's an important point that the public should know, that the concern about variants shouldn't dissuade anyone from getting the vaccine.
And are we seeing any differences in people that have received like the Johnson & Johnson versus the Moderna or the Pfizer, how they're responding to these breakthroughs?
I can tell you we haven't seen any relationship to the vaccine. All the vaccines, at least that we've seen and administered, we haven't seen any significant difference in people getting infected or not.
Rochester Regional has not either, and the best way to answer that question will be forthcoming research, as the large number of patients vaccinated will provide the most substantial conclusions to that type of research, rather than a local experience per se. But more will probably be published on that in the months ahead, but at this point in time, we see equal efficacy of the vaccines.
Thanks, Dr. Mayo, and thanks, Raquel. Brian, you're up next, and then Raven Brown at WEGC.
Just echoing everybody else and thanking you both for taking the time today. Was wondering, I know the question was asked about hospital staff, but I was wondering if you could address also staff at your respective nursing home and long-term care facilities. Recent numbers I saw show that those percentage of staff vaccinated is notably lower than what you were quoting for the hospital, and was wondering, as far as if you could address why that is and how much of a concern that is, given, as you were saying, most of those patients, however, are vaccinated.
Sure, thank you for the question. It is correct that the vaccination rates among long-term care employees is lower than in the hospital setting and lower than the long-term care resident rates. And that is a consistent data observation across the state of New York and the country. And what we are doing here locally is reaching out employee by employee to understand their concerns, to do our utmost to mitigate those concerns and encourage vaccination. Those employees continue to receive a more rigorous testing procedure based on the state's executive orders, and so they continue to be tested twice a week. And so we're grateful for that, and we're keeping a close eye on them and their well-being as well as our residents' well-being.
Yes, for our affiliated nursing homes, the rate of vaccination of our staff is significantly less. I don't have that data today. I can tell you the vast majority of all the patients, though, have accepted vaccination, and we've seen very few infections in our nursing home patients.
Do you have a follow-up, Brian?
Yeah, and I was just wondering, I don't know how much either of you get involved in some of the modeling that is done, but was wondering if you have sort of an expectation of what, if we're on a plateau at this point for patients and infections and what you're expecting to see, or if any of your modeling shows when we're going to see, further drop.
So the current modeling we're looking at suggests a very slow decline over the next weeks to couple of months. So we're at about 70 patients, and it doesn't show, at least at this point, a spike, but a slow decline over weeks to months. But we don't see it going away, the number of admissions, in the near future.
Yes, and Rochester Regional and URMC daily pool their data. So there's a data team across the city that provides those predictive models. So that's the exact same information that I would share as well.
Now, I would want to add on to that, the modeling assumes the same rate of vaccination. And if we as a community could pick up the rate of vaccination, it would cause the model to shift and less patients would be admitted to the hospital.
Thanks, Brian. And Raven Brown at WHEC 10.
Hi, guys. Thank you. So Brian actually had my question about nursing homes, but just to follow up on that, if the vast majority of patients have received a vaccine in the nursing homes, do you guys think it's time to start loosening up restrictions? We're still hearing from families saying they can't get in and they can't see their loved ones.
Yeah. Now that's a great question. That I think it's a much safer environment now. But the one thing that we at URMC and Rochester Regional is a great partnership with the governor, the Department of Health, the local health department, and so I think at this point I would defer that to Mike Mendoza and the Department of Health about visitation rules for our nursing homes.
Thank you. And so my follow-up question, and I don't know if you guys have input on this, but we know ERs are still packed. We're hearing a lot of that is due to social distancing. A lot of EMTs say they can't bring in their patients. They have to wait outside because of the social distancing. With more people getting vaccinated, is that a possibility to limit social distancing?
For the time being, because of the pressure on the emergency departments, we have a citywide agreement that there are no visitors in the emergency departments. So we continue to monitor that situation. We know it's important for families to be at the bedside of their loved ones, and we will update that as soon as possible. It is important for people to remember and to differentiate the visiting restrictions are much more loose in the hospital, right? And so we do have families in the hospital. They are following the procedures for screening and so forth. But in our emergency departments, we need to manage tighter visitation due to the pressures of the work and the close environment.
And even without visitation, the emergency rooms remain very busy, busier than even pre-pandemic, where a lot of the concern that you've heard from emergency medical services has to do with patients in the ED, not visitors and social distancing. So this becomes important, because if we can reduce the number of patients admitted with COVID, and we can do that through vaccination, it'll open up more space for patients from the emergency room to get admitted to the hospital, and more room for patients from emergency vehicles to get into the emergency rooms quicker.
Thank you.
Raymond. Andrew, I know you had a follow-up, and before we go, we'll ask if anybody else has a follow-up. But Andrew, go ahead.
Hey guys, back again. Yeah, and thanks for doing this. Wanted to ask about, this is sort of unrelated, although possibly it is because of the pandemic, is the shortage of medical supplies like tubes used for blood testing, sampling. That's going on nationwide. Sounds like also in our region. Can you guys talk about the impact you're seeing at your respective healthcare systems and what patients need to know what that means?
Yeah, it's a great question. We in healthcare have been dealing with this for a while, and so certain medications, infusions, we're a just-in-time society, and no one stores anything anymore. And so, you know, factories produce just enough, and as long as the supply chain remains stable, everybody has enough. But you have one factory or one area that can't produce for a short period of time, and all of a sudden there's a shortage in the supply chain. The most recent issue that I think you're talking about is Bluetop tubes to collect tests for coagulation. We use these very frequently in people on blood thinners, and this has caused a concern. Right now, we still have a few weeks supply. We're watching this very closely, and we're hopeful that the manufacturer can continue to make these tubes. We have made internal adjustments to limit the test to only patients who need the test, and we're very hopeful to make it through without running out of these tubes. But we deal with these sort of shortages all the time with different medications and supplies.
Yeah, we really do. It's a challenge of modern healthcare, believe it or not, that supply chain interruptions, sometimes there are FDA recalls or interruptions in manufacturing because of regulatory, actions, and all of that, impacts the front line and the front end of the distribution chain. So the Bluetop tube situation did come up very quickly. It's a very important set of blood tests that we need to have available for our patients for their safety and for the proper monitoring of medications. We took this very seriously. Dr. Apostolakis and I communicated a number of times about this across the city to be sure that we understood the situation at each institution. Very capable multidisciplinary teams came together to really address this, creating some internal adjustments, reprioritization of testing criteria, as well as introducing some newer testing alternatives. So all of those things combined have relieved some of the pressure that we were feeling on the Bluetop tube shortage, but that does remain an active concern, and we are carefully monitoring that as well as other blood tubes and medical supplies.
Thanks, Andrew. I owe an apology to Lowell Rose from Spectrum News. Lowell, I didn't realize you were there, so you can ask the question in a follow-up, and I see Brian Sharp has one final follow-up as well.
Thank you. I got the link late, so my apologies as well. I had 3 questions, and again, I apologize if they've already been answered, but one, do you think we will see a surge after the holiday weekend and more things opening up? That's my first question. My second, booster shots. I know that's kind of a big question. Will we need them? How will it work? Who all will it be required for? And my third question, I know we've seen the vaccine site at the Kodak site on the northeast side of Rochester shut down. Just what are your thoughts about that and continuing the vaccination process for those vulnerable communities?
The third one was asked already. Well, I don't know if either Dr. Mayo or Dr. Apostolakis want to talk about just about Hawkeye. Maybe Dr. Mayo?
Sure, I can just take that quickly. Thank you for the question, Lowell. I'm glad you could join us. naturally, we've been very appreciative of the great volume of vaccinations that site has provided our community. This location was very helpful to reach throughout the city. But there are many locations for vaccination. We'll continue to monitor the equity of vaccine access and delivery. And I am confident that the combined leadership of the Department of Health and city and institutional leadership will address any concerns that surface or that grow out of the closure of that site. So I think that we're in pretty good shape with our vaccine access, but there is always more we can do.
Dr. Mayo, while you're on, do you want to take on the booster shots?
Oh, yes. Yeah, that's a great question. And we did not talk about that. And that is something that is popping up across national news as well. The CDC has not made a final recommendation, nor has the FDA regarding booster shots. There have been some forecasting comments saying that this is possible and that we may need a regular frequency of booster shots. But I think that we need to wait and see what the additional research shows about a more specific booster, what the dose will be and what the frequency will be.
And Dr. A, what about are you worried about a spike from the Memorial Day holiday?
Quite frankly, the beauty of Memorial Day is that most of the gatherings are outside and there's very little transmission outside. I'm hopeful that the community obeyed the rules. If you're vaccinated, you can be without a mask out in public. And if you're not vaccinated, you wear a mask. So at this point, I'm not anticipating a spike, but we'll watch closely and we should see within 10 days or so after Memorial Day to see whether it comes through. But our community has been really good throughout this pandemic, and I suspect that we're not going to see a spike.
Thank you, Lowell. And Brian Sharp, you said you had one final follow-up?
Yeah, I think this one's been asked somewhat similarly. I know you mentioned already that the patients are younger because of the vaccine, but I saw a report just about with sort of this, the difference between the vaccinated and the unvaccinated and directives that people can unmask if they're vaccinated, just that the cases and the variants might be shifting. And I was wondering if you are seeing any difference with, as folks maybe though unvaccinated go unmasked and the variants pass, if you're seeing any difference in how the cases present when they get to you of either severity or how you got to go about treatment or anything like that?
So we don't have all that data yet. I can tell you the majority of cases that we see now are variant, the UK variant. As far as the severity goes, doesn't seem to be at this point any more or less severe. And as I stated, if you're vaccinated, we've seen very few patients that have gotten ill. Most are asymptomatic if they get ill from COVID if they've been vaccinated.
Dr. Mayo, did you want to address that one too, or?
No, I think that's a great answer.
All right. Well, first I want to thank Will and Morgan for providing our ASL translation today. We really appreciate them being available, especially on short notice. Thank everyone in the media for joining us and asking good questions today, and especially thank Dr. Rob Mayo and Dr. Mike Apostolakis from Rochester Regional Health and URMC. With that, I think we can end the meeting, Jennifer.
Thanks.
Thank you, everybody.
Bye now. Thank you.